I'd like to welcome everyone to our Facebook Live event for the Masters in Nursing at Indiana University East. We are offering this 30-minute session to give you more information about our programs, the tracks that we offer, and information about cost and application requirements. We will have different speakers for the first 20 minutes or so of this webinar, and then we will also have time for a question and answer session at the end. If you have a question, please put it in the chat and we will respond to the submission at the end of the session. My name is Paula Baumann, and I am the Associate Dean for Graduate Programs at Indiana University East. Our Masters in Nursing programs are nationally accredited by ACEN, and we have been offering graduate programs for over 10 years, starting in 2012. We offer a family nurse practitioner track, a track in nursing administration, and a track in nursing education. I will do a brief overview of the three tracks, and then we will have our nurse practitioner faculty go into more depth about the family nurse practitioner program. For the nurse educator and nurse administrator tracks, we do a rolling admission, which means you could start in either the spring, summer, or fall semester. It is a 36 credit hour program for both tracks, and the core classes are offered in a hybrid format, which means you come to campus 4 times during each semester on a predetermined date, and then the rest is done online using our Canvas learning management system. Our in-person meetings are always on a Thursday, and usually they happen the first week of classes, one time each of the next 2 months, and then usually at the end of the semester for the final meeting date. Students usually take 2 classes at a time for a total of 6 credits. Classes start at 8:30 and go to 12:30 for the first class. And then there's a half-hour break for lunch. And then the second class meets from 1 o'clock to 5 o'clock. Once students get to the track-specific classes in the administration and education programs, those classes are totally online and they are shared with some of our other IU regional campuses, such as IU South Bend, IU Northwest, and IU Southeast. So you get the opportunity to interact with individuals from other campuses. Once you complete the core classes for the educator and administration tracks, and you're completely online, the final class that you'll take is your practicum course, and that happens on the campus of your admission. So if you apply to IU East, you would be doing your practicum with faculty from the IU East campus. During those practicum hours, you'll spend time with a designated preceptor, and we work with you to help you identify someone either in the administration setting, if you're in the nurse administrator track, or with one of our educators at IU East, if you're in the education track. The administration degree is designed for either an aspiring nurse leader or someone who's already working in an administrative role and wants a more formalized education with a degree. The nurse educator track is designed for nurses who either want to work in a college or university setting, teaching nursing, or someone who wants to do staff development and education in a hospital setting. Our family nurse practitioner track prepares students to sit for certification to work as a family nurse practitioner, and it is a 42 credit hour program. IU East does a once-a-year admission for this program, and the deadline for applications for this program is September 15th, and you will start in January 2024 in the spring semester. I will now turn it over to our family nurse practitioner faculty to provide additional information about the FNP programs.
Hello, my name is Cindy Evans. I am a clinical assistant professor and the director of the Family Nurse Practitioner program here at Indiana University East. I am dual certified as a family nurse practitioner and a women's health nurse practitioner. I've been a nurse practitioner for about 25 years, so I've really seen the growth that nurse practitioners have had over the last 25 years, and it's just been amazing. I continue to work part-time in the clinical practice to maintain my skills and my certifications. I'm going to share some information about our program and why you should consider becoming a family nurse practitioner at Indiana University East. Amid the ever-changing U.S. healthcare landscape, nurse practitioners have become the healthcare provider of choice for millions of Americans. Nurse practitioners diagnose, treat, and help prevent common and acute illnesses and manage chronic diseases. Health promotion and disease prevention are primary focus. Nurse practitioners are advanced practice registered nurses with specialized training. There are many nurse practitioner specialties that one can choose: pediatric, women's health, adult gerontology, acute care, and several others. However, it is important to note that a family nurse practitioner certification gives you the broadest focus as you're able to care for a wide variety of patients of all ages across the lifespan. So this would include newborns and infants, adolescents, adults, and the elderly. Family nurse practitioners work in a variety of healthcare environments, such as hospitals, primary care offices, outpatient facilities, urgent care clinics, private practice, community health centers, and long-term care facilities. At Indiana University East, family nurse practitioner students have the advantage of small classes. Currently, we accept 12 FNP students per year. The small class size allows more focus on you as the student, greater access to the faculty, and a more personalized educational experience. We are here to encourage you and support you and help you succeed in this journey to advance your nursing career. Our IUE's program includes core classes in theory and leadership, the 3 Ps, which includes advanced pathophysiology, advanced pharmacology, and advanced health assessment across the lifespan. Courses also include family dynamics, advanced office procedures, and differential diagnoses course. Our primary care courses are designed to allow students to take advantage of caring for any type of patient visit while in the clinical setting, which can then be counted towards the required total clinical hours in each category. If you enjoy working with diverse populations, making a difference in your community, and are skilled at empowering patients to maintain their health throughout their lifespan, then a career as a family nurse practitioner may be the right choice for you. Next, I would like to introduce Jennifer Bowe, who will share more information about the family nurse practitioner clinical hours and settings.
Hello, my name is Jennifer Bowe, and I'm the clinical coordinator for the Family Nurse Practitioner program at IU East. I help to assist students with their clinical placements and help make sure they're getting the required hours. So I'll give you a little breakdown of our hours. We have a total of 600 clinical hours for the program in total. There are 4 clinical courses. The first 3 courses have a minimum requirement of 75 hours. In our first clinical course, there can be 25 extra hours that can be banked and accumulated. The next 2 courses, an additional 50 hours can be banked and in that course. And so that means the last course can range anywhere in clinical hours from 250 hours to 375. A minimum of 480 hours are primary category A hours. So those are primary care hours, seeing adult, pediatric, or women's health patients. We have a minimum of 75 hours for each of those 3 categories: adult, pediatric, and women's health. Because we don't have specific classes for each of those, you accumulate hours throughout the program. So if you see a pediatric patient, you would log those hours under the pediatric requirement. Women's health would be the same. We have the ability for students to get hours in specialty areas, especially places that they might be interested in practicing: cardiology, pulmonary, endocrinology, dermatology. There's a certain amount of category B hours, those specialty hours, that can be counted toward the category A total, and then there's a certain number of hours that are specialty category B hours. So it can be kind of complicated, but we help you throughout the process to know what you have to do for hours, what places you can do clinical work, and to help you coordinate that, help to track whether you're on track with your pediatric hours, women's health hours, try and match you with preceptors that will help you do that clinical component. So obtaining clinical hours and matching students with preceptors is more challenging these days. Many major health systems have a process in place for that. So there's an application process and a matching process and some different things that different health systems require of students. So we help you navigate that, let you know when deadlines are coming up, help navigate what you need to turn in, when you might need to do certain items, who you might need to talk to about questions for that. Often many employers will give precedence to a student who is going through a nurse practitioner program to help them place their clinical hours inside that health system where the student might be working. So we help coordinate that. We also help to make sure we have clinical contracts and everything in place to help you get the clinical hours that you need. So often students know preceptors that are willing to work with them. So we also help in that process as well. So I'm going to turn it over to Kira Habak to give you some more information.
Hi there. My name is Kira Hallball. I am one of the assistant professors for the Family Nurse Practitioner program here at IU East. In addition to my role as an educator, I'm also a practicing family nurse practitioner part-time. My teaching responsibilities here at IU East include several of the courses in the FNP program, and then also core classes such as advanced pharmacology and advanced health assessment. And these classes are taken by students in all three tracks: the FNP track, the nursing education track, and administrator tracks. Additionally, I serve as clinical faculty for the FNP program, and I work closely with the students and their preceptors to help facilitate their clinical experience here at IU East. As my colleague Jennifer mentioned, one of the key advantages to the FNP program at IU East is our assistance with clinical placement. Securing clinical placement can be a challenge in the competitive FNP education community. We are fortunate to have a strong relationship with Reed Health, which is located adjacent to our campus. Through this partnership, we're able to arrange a lot of our students' clinical opportunities locally and provide them with valuable hands-on experience. Assistance with obtaining clinical placement is always encouraged. This can be done by students by actively seeking placement opportunities, checking with colleagues, fellow students, people in your community, family and friends to see if they know any nurse practitioners that are willing to take students. Our FNP program is designed to be completed in 7 semesters. As Jennifer mentioned, our clinical rotations will begin in the 4th semester. Typically, students will take the initiative to contact their preceptor prior to the start of their clinical rotation, and they will establish an agreeable schedule that will work around both of their schedules. We recommend that students are flexible with scheduling this to ensure that they're able to complete all of their clinical hours within their semester. Another advantage of our FNP program here at IU East is the distribution of clinical hours over 4 semesters, as opposed to 3 semesters that is typically offered by other programs. This extended time frame typically allows our students greater flexibility in balancing their academic and professional commitments. As a nurse practitioner student at IU East, you also have the option to complete your clinical rotations in Ohio. It is important to note that you must hold a valid RN license in the state you will be completing your clinicals, or also a compact RN license. You will be practicing under supervision of a licensed nurse practitioner, but it's still necessary to hold a valid RN license in whichever state you're practicing. Both Ohio and Indiana do recognize now the compact RN license. So this provides us several opportunities to allow you to complete your clinical rotations given the proximity to the state border. In addition to the traditional clinical experiences, our FNP program offers a range of opportunities for students to gain hands-on experience. These opportunities include an immersion trip to Belize, where students provide care to underserved populations, and a week-long summer camp where students work with children living in diabetes. That's just a little bit of the information about our FNP program, and I will pass it on to Sherry.
Hi, I'm Sherry Dolahanny. I'm going to share my screen here. So I'm an academic advisor for the MSN program, and I assist students with admission and application and admission processes for the program. So I just want to start with letting you know that the best place for information after this webinar today, if you want to refresh your memory about anything that's already been talked about or just learn more about the application process, is really our webpage. It has the information about the curriculum and the deadlines for applications, and there's an apply now link on that page. So it's the easiest place to get all of the information and then just start your application process right away. So just a moment. But I think the main thing to keep in mind when you're ready to apply are deadlines. So the application process is explained on the website, and I'll talk more about the items that you'll be submitting and experience that's required. But in terms of the track that you choose, that can impact your deadline for admission applications. So the education and the administration admission timelines are rolling. So that means that once you submit your application, you're essentially considered for the next upcoming semester that you're interested in. And I pass the information off to our faculty committee who reviews your application, and then you can start that next semester. So if you were, for example, to apply now for education or administration, you could start when our program starts in August for the fall semester. The FNP program, however, is competitive admissions. And so we have a set window of time when those applications are accepted. So it opened in April. Your application materials would need to be submitted by September 15th. That's the deadline. And then our faculty review the applicant pool and selects 12 to enter for January, the upcoming January. So FNP always starts in January. The application process is always from April to October. So I think the main thing to keep in mind is just to be aware that there are items that you'll need to be collecting from other people, which I'll talk about in just a second. So you want to make sure you have enough time based on when you want to start the program to actually get your application materials in order. So as far as the items that we require for the application, we need college transcripts from anywhere outside of IU. As an Indiana University campus, we have access to your IU transcripts. So if you were an IU student prior, we'll be able to see that coursework. But any coursework outside of our system, the IU system, we would need college transcripts for that. The faculty also want to see resume or curriculum vitae so that we can get a sense of what your experience has been thus far up until the application point. We also ask for a personal statement. So that gives you an opportunity to tell us about your experiences, why you're interested in the program, if you have a particular area that you're interested in, so that we can get to know you a little bit more than just what we would see on a resume. We do also ask for 2 professional references. So that should be someone who's familiar with your observing you in the workspace. They're very familiar with your performance in the profession. So 2 references that you would be requesting from outside yourself. And then we do also require a drug screen and a background check as part of your application materials. And then beyond the materials that you'll submit, the website gives more information about this as well, but background and experience that the faculty admissions committee will look for are, you need to have your BSN complete, or RN to BSN can be in their final semester. And I'll talk a little bit more about that in just a second. You need your active unrestricted RN license for Indiana. And then you're going to get more out of the program, the more experience that you've had as an RN. So we do require at least 1 year minimum experience as an RN for administration or education, and then 2 years for the FNP program. You can potentially hit that 2-year mark after you've started the FNP program, but that's something that the faculty would talk with you about if that's an exception in your case. So, let me back up. Sorry, just a second. So the students who are already RNs pursuing an RN to BSN program, it is possible for you're welcome to go ahead and apply for admission to the program, even though you haven't quite finished your degree. Your admission status would just be contingent upon the fact that you finish your program. So for example, if you're pursuing an RN to BSN program currently, but you're interested in starting in the January 2024 cohort, you just submit your materials by September 15th. You would be considered with the rest of the applicant pool as a regular applicant. And then if it's determined that we want to offer you one of the 12 spots, your admission would be contingent on the fact that you finish by December of 2023. So if you're in a program now, please don't let that deter your enthusiasm to apply for this upcoming January. We would still like to see your application as long as you're completing an RN to BSN program. So aside from the admission process, probably the most common question that I get from applicants is about the cost for the program. So the information here is broken down based on the way our fee structure is set up currently. So we have tuition, we have mandatory fees, and then we have a clinic fee for some of the classes. So you can see it's based on in-state rates for the graduate nursing program level. The MSN education and the administration programs are based on 36 credit hours. Those are the credit hours for the program. FNP is 42, so that total tuition cost is going to be more because it's more credit hours. The mandatory fees are based on a term basis. So again, those are a little bit different across the tracks based on how many terms you're taking classes. And then the clinic fee is based on how many classes in the program that you're in require clinic experiences. So everybody essentially takes one class across all of the tracks that has a clinic fee, and then the FNP students have 4 additional classes that will have that fee. So you can see the totals. I do want to share the caveat, though, that this is based on the rates that were effective for 2022-23. We are still gathering information about any changes that might go into place for the fall semester. So please feel free to reach out to me. By the end of this month, we should certainly have all of those details in terms of any changes that might be happening for going into this next academic year for the 2023 fall, spring 2024, and summer 2024 terms. I also want to be clear that textbook costs are not included in these figures, and that's because textbooks are kind of a moving target in terms of cost. There's a lot of variety in terms of whether you rent or buy the textbook, if you get a digital version or a paper version of the textbook, if it's still offered. So it's a little bit hard to give what feels like a solid estimate on the textbook expenses, just because you as a student have legitimate control over how the format that you choose for those textbooks and materials that you need. The other cost to be aware of is the application fee itself to apply for admission is waived. So there's no fee for that application, but there are expenses that are associated with the required background check and drug screen. So be prepared for that. And then my understanding also is that the FNP students will maintain a Typhon account, and there may be charges associated with that as well. So for more information, this is our contact information. I will leave this up on the screen so that it's available while Paula wraps us up.
So now we'll look at some of the questions that we have received during the webinar. So the first question that we have is, if I apply, will I be guaranteed to get in? So as long as you meet the requirements, and those are all explained on the website itself, you can see the requirement and the criteria that we have for the program. Then the education and the administration track, if you meet the requirements, we've got lots of room for the students. So please apply if you're interested. For the FNP, though, it is a competitive program. It's competitive admissions. We just have 12 spots that we offer each spring. And so that's going to depend on the others who have applied for that particular year and where your application stands in the midst of that pool. So, but please don't let that
please apply. Essentially, let us take a look and see if it looks like it's going to be a good fit for you and for us. We're looking for students who have valuable experiences to share with their classmates as well. And that could be you.
Okay. The next question is, what if my GPA is not a 3.0? And so we look at the candidate more holistically. And so students who do not have a 3.0 should still consider applying, because we look at your academic, we look at not only your academic successes, but we also look at what type of clinical experience you have, your recommendations, your personal statement. And we know that sometimes students started when they were younger and maybe didn't have the best success, but then they pulled that GPA up as much as possible. So we would like to encourage you to consider still applying, even if you don't have a 3.0, and we will look at your application holistically. Okay, another question we received was, will I take summer classes? I'll answer that one too. So the programs are designed, the MSN in administration and education are 6 semesters, and those are continuous. So if you would start in the fall, you would go fall, spring, summer, fall, spring, summer. Now we can accommodate practicums in the summer semester for the administration track, but sometimes we don't have as many students taking classes during the summer. So a student who would start the education track in the fall may need to extend an additional semester into the fall in order to get their practicum completed. But we can look at things and adjust the program plan as necessary. But if you start our program, all 3 tracks would have summer classes. Cindy, I'll let you answer this question. How long does the program take to graduate?
I'd be happy to. So for the FNP program, it's a total of 7 semesters.
He may have frozen.
Right away, or is there a semester or 2 before they start? So as far as the family nurse practitioner program goes, you actually don't start that until the 4th of the 7 semesters. So you'll start in the spring, and it won't be until the following spring that you actually have your first clinical course. So you're doing all of your prerequisites and things prior to that. So fourth semester, which would be the following spring.
So I see some additional questions in the chat room. So one question is, do clinicals start right away, or is there a semester or 2 before they start? And I think Cindy answered that, but she kind of cut in and out. So I'll go over that again. So if you are in the administration or educator track, your actual clinicals will be at the end of the program. So they won't start right away. If you're applying for the FNP program, you will start in the spring with a lot of those core classes, and it won't be until the second spring or the 4th semester that you'll start clinical time. So you do have some time before you start. Another question I had was, I'm an alumni of IU East. Do you go by the GPA then, or I have an RN to BS? I've been an RN to BSN for 24 years too. So if you completed your career at IU East, or at an IU program, we can look at your transcript and see your GPA at the associate level and the RN to BSN. We take a look at all of that in totality. But like I said, we do consider applicants who are below 3.0. And if you are attended an IU school, we can get your transcript through our system. We do not have to have you submit that. We can access that when you apply to the program. Sherry, do you have anything else that you could add to that, or no? Okay, great. I think another question we had is, how many classes do I have to take at a time? And so our program is designed to take 6 credits during each semester. And we do that for 2 reasons. All of our classes are 3 credit hours. So that allows you to take 2 classes at a time and get done in that 6 or 7 semester time frame, like we mentioned. The other reason that we do that is if you need to access financial aid at the graduate level, 6 credits is what's considered is the amount that you need to be considered financial aid. So that's why we have 6 credits or 2 classes at a time. Another question that you might have is, can you go part-time? And so although we don't have an official part-time program, if you had an unusual circumstance where you needed to maybe only take 1 class, that could be a possibility in the education or administration track. It does get a little more complicated in our FNP track because we are giving you a spot, and based on the clinical placements and how we do faculty to students, it's a little more difficult for you to go part-time in the FNP program. Same way with the question, can I stop out during the program? If you need to stop out in the administration or educator tracks, it's a little easier to accommodate that. In the FNP track, you could stop out, but then that may require that you sit out for an entire year to get back caught up with your cohort. So I'm monitoring the chat and I don't see any additional questions. Does any of the other faculty have anything that they would like to add before we conclude our webinar?
I would like to, I forgot to mention opportunities for assistance for the cost. And so I just want to, we do have some scholarship opportunities. So be aware of that as you're thinking about applying for us. Typically, we just recommend that you start your application process for financial aid through the free application for federal student aid, the FAFSA. So depending on how recently you've been in school, that might be a very familiar document. And if not, then please, our financial aid office are the experts to reach out to, and they can help you with understanding where to access it online and start that process. I would, you can contact financial aid. You can find their information on our webpage to get to them. But one kind of pro tip I would give you contacting their office is to make sure you let them know when you're talking with them that you're a grad student, because we have undergraduate and graduate students. Most of the questions that they field are from undergrads, and the aid availability is different for graduate programs. So if you just come out of the gate when you call and let them know you're looking at a grad program, that's going to help make sure that you get the most accurate information about the aid application processes and the resources that are available to you. The other piece is, okay, I thought this one about. Sorry, the other piece of information is that, I'm so sorry. The other piece of information is, beyond the scholarships that we have and the federal and student aid, there may be opportunities with your employer in terms of tuition remission, some kind of a benefit like that. And we do have what's called the deferred payment option. And with that, you're able to defer your payment for that's due for the semester to the end of the term, which might be much closer to when you would be getting a tuition remission benefit of some kind through your employer. So we are working to make the financial piece work as well as we can for students, in addition to providing lots of support on the academic side as well. That's it.
Okay. And we had one additional question. So the question is, are we required to find our own clinicals? And so you are not required to find your own clinical placement. We that's one thing that's unique about our program, and is that we have preceptors that we use regularly, and we definitely assist heavily with the process. What some of the other speakers were talking about is, if you are an employee at a health system and you would like to do some of your clinicals with practitioners in that health system, certain systems require that you fill out an application and complete the process in order to be placed there. So there will be some paperwork that you need to complete. And if you have some connections or you have the ability to suggest someone, we will work with you to make that happen. But we are very dedicated to finding placements for you. And like we also mentioned, we do have a trip to Belize where students can get get a lot of their women's health and pediatric hours by going on that immersive trip, which is usually 1 week. And then the other thing is we have contacts with a diabetic camp in the state where students can sign up to do that, and they can get a good majority, if not all of their pediatric hours completed during that experience as well. Does anybody have anything else that they want to add about that question about finding clinical placements? If you were asking about the administrative track or the educator track, we work with you to find someone who is in an administrative role in either at your work setting, or we have contacts with other health systems that are willing to take students. And then if you are interested in doing education through an academic setting, we have qualified faculty who can be your preceptors here at IU East. If you have another system that you're interested in, we can work with them to find a preceptor. Or if you're interested more in hospital-based staff development, we can help assist, get you connected with someone who would be your preceptor in the healthcare setting. Anything else that faculty would like to add before I'm monitoring the chat room? And I think we got most of the questions. So I would like to thank all of you for participating in today's webinar. Just a reminder that our contact information has been shared within the webinar, and also the link to our webpage. And we did a recording of the webinar, so you will be receiving an email after the webinar concludes with a link so that if you need to watch any section again, you'll have access to that. We also look forward to hearing from you and hope that you decide to pursue your MSN at IU East. If you have any questions, please reach out to Sherry, Cindy, or myself. And we thank you for attending and have a good evening.
Bye.